my small series on tethered oral tissues or TOTs. And what are tethered oral tissues? So we're going to actually talk about that today. And this is sort of part one of the series, but we will talk about a whole bunch of other aspects of tethered oral tissues, what sort of signs to look for, symptoms to look for to know if your baby does have potentially a tethered oral tissue, tongue tie or lip tie. Also different kinds of myths that are out there in terms of tethered oral tissues, and a bunch of other fun things. But if you would like a really comprehensive, easy resource to follow, I have just created a Tips for Tots ebook, very low cost, and it has all of the information in it that I'll be sharing over the next few sort of weeks in this series, along with lots of different oral motor exercises to get that tongue retrained, to get the lips and the cheeks working properly so that you can help your baby improve their feeding or potentially their speech or rest posture, all of that kind of stuff, before and after a release. All right, so let's get started today. First of all, who the heck am I? So I'm Kylie. I'm a mama, a wife. I love babies. And really, over the past few years, I have developed a passion for tongue ties and have started to learn so much more about them. If only I had known about these when my firstborn Christian was a baby, because both of my kids actually have tongue ties. They're 4.5 and 7 now. And because I just didn't know about it at the time, they still have them to this day. And unfortunately, now we're dealing with the aftermath of not having had the necessary therapy and releases when they were little. And so we're really exploring the world of myofunctional therapy, difficulty managing certain solids, hypersensitive gag reflex, high and narrow arches, and now crowding of their teeth. There was a little bit of sort of unintelligible speech for my youngest. And lots of other sort of issues with jaw development and everything else for my kids. So we're now on this bigger journey. And my goal really with this series of videos and also with my newly created Tips for Tots ebook is to bring awareness to tethered oral tissues and also some helpful tips and tricks. And really knowing a little bit more about information on the release procedure, the wound care, the therapeutic exercises that you can do at home before and after a release, so that you can really set your baby up for success in using their tongue, lips, cheeks, and even jaw properly from the beginning, or at least close to it. So let's start into what are tethered oral tissues. So we all have tongue and lip frenums. Sometimes they're called frenulum. So it's called a frenum, this little stringy piece. Either a frenum or a frenulum basically means the same thing. They're essentially tissues or a string that attach our tongue to the floor of the mouth. This is called the lingual frenum. Or our lips to the gums. This is called the labial frenum. Sometimes babies are born with significant restrictions in these tissues that affect the movement, affecting movement of the tongue, but also affecting movement of the lips, and therefore the function of the tongue or the lips. So the tissue, that little piece of string, it's actually fascia, and that's a connective tissue. So that tissue, that frenum or frenulum under the tongue, that's too tight, too thick, too short, or sometimes too close to the tip of the tongue. And that prevents the tongue from lifting up, which is elevating, or moving side to side, which is called lateralizing, but also out and in, and essentially moving freely in the mouth. When this affects the function of the tongue, then it is considered a tie. Now, one of the things that we have to be careful of is that we can't just diagnose a tongue tie based on what it looks like only. You have to sort of look at where the insertion is, whether it's too tight, too thick, too short, but also what is it preventing? Is it preventing the range of motion of the tongue, for example, if you're looking at the lingual frenum or the tongue tie or the tongue frenum? Is it preventing the ability of the tongue to move side to side? Up is actually the most important one that we want to look at, and out and in. But also, is that dysfunction of the tongue leading to a bunch of functional issues that your baby is presenting with? And we'll do a separate video on the specific symptoms to look for, but you really want to start looking at that piece as well. And I think that sometimes that functional piece of what this is causing your baby difficulty with is missed. So we're looking at what it looks like, so the form, we're looking at the function of the tongue, but we're also having to look at what is that causing your baby to have difficulty with. Are they having difficulty with feeding? Are they having difficulty with getting on the breast? Is mom having lots and lots of pain with breastfeeding? Does your baby have a lot of reflux? Are they really gassy and uncomfortable? So many different signs and symptoms that can mean that there is some kind of oral dysfunction, whether that oral dysfunction is due to a tongue tie, like a too tight, too thick, or too short lingual frenum under the tongue, is sort of, that's where we have to kind of look a little bit more at what's going on with the tongue. What does that lingual frenum look like? Where is it attached? What is the form? But we really, really, really cannot forget about the function piece of what that is causing difficulties in for baby and or for mom. Lip ties are the next one. So everybody has one of these little tissue pieces under their lips. And this lip ties is really also, if it's too tight or that's too short or too thick, sometimes it comes over the gums and causes a big gap. Sometimes you can really see that it's blanching, which just means that it's white. When you lift your baby's lip up, it turns white, that piece. And this is called a maxillary labial frenum on the top lip. Sometimes they also happen under the bottom lip. And you can see we all have the frenum, but when it's too tight, too short, or too thick, or it comes over the gum ridge too much, so that one's called the mandibular labial frenum, but that can cause a lot of functional difficulties. So it can cause the baby's lip to kind of curl in versus to phalange out, which is really what we want. We want the top lip, we want the bottom lip to phalange out when on the breast or the bottle. And a lip tie can really prevent the lips from fully closing around that breast or that bottle nipple to really form a good seal, which can then lead to more air intake, which can lead to air-induced reflux. But it can also prevent the lips from closing when the body and mouth are at rest and also during sleep. And that means that your baby will then be mouth breathing instead of nasal breathing, which I have done videos on before, but maybe we'll add to this sort of multi-part series as well. And then the last piece of the tethered oral tissues is actually called a cheek tie. And this is a little bit less known. It's not researched as well as the tongue and the lip ties. It's not as common, but it is still something that we should be checking for. It is still something that your release provider should be checking for, and that we're really feeling inside, because the cheek ties can cause a lot of dysfunction for baby and even for mom as well. Okay, so cheek ties, or sometimes called buccal ties, they can happen on either side of the top of your mouth, usually in this area, and also the bottom, sort of by the cheeks and the gums. And often, babies that have dimples often have some of these buccal ties because there's something that's pulling from the inside, pulling that dimple in, right? And so really kind of like looking in your baby's mouth, if you're feeling that they're tight, if you see a piece of sort of tissue that you're like, oh, what's that? You pull their cheek back or the top lip and their cheek back and you see a tissue here, that is potentially a cheek tie or a buccal tie. And the way that we know the difference, remember, is whether it's a tie or not, is it affecting function? So yes, the form matters. What does it look like? We also need to look and see what the range of motion is and if there's any difficulties in the range of motion because of that form, right? So if it's too tight, too thick, too short, is it affecting function? So your lips should phalange totally out, cover your nose, be really flexible, and that should be easy. Same for the bottom lip. Okay. If you can't do that with your baby, I would go get a further assessment done. Same for the tongue. The tongue should move up and down, out and in. Oftentimes, professionals will say, "Oh, your baby can stick out their tongue, no problem, there's no tongue tie." That is such a myth, and we'll cover myths in another video. But this is sort of the first part of this tethered oral tissue series. If you want more information, please feel free to check out the link below this video to have a look at the Tips for Tots ebook. That's it for me, everybody. Have a wonderful day, and I will see you next time.